Casanova. I'm nurse practitioner here at Cornerstone, and we are going to do what's called fascia taping, or what's also known as therapeutic taping, and there's different types of tape that can be used for this, but there are certain brands that I think work better than other brands. We're going to be using rock tape today on Jill, who's hurt her shoulder. And the purpose of it is to help to bring circulation to the area. It's also to help support the fascia, the layer that lays across the muscle. It encourages the muscle to move in the appropriate direction, and the fascia that lays over it to move along with it. It reduces friction, reduces inflammation, and brings healing, and brings about the circulation, which also helps with healing. So this is what we're going to do with her today. It does come in different colors. Jill likes to use black. There's also like a flesh kind of color. There's blue, camouflage, tiger stripes.
I think it was like a hot pink one.
Hot pink. There's a lot of different colors, so whatever suits you and your taste. There's a lot of different options. So to start with, we're going to take a strip and we're going to bring it across from the middle of her trapezius back here. We're going to bring it along the trapezius and down the deltoid and then down her bicep to give her the first bit of stability. So I'm going to start by just sort of getting a general measurement of about the area that I need. This tape will stay on for around 3 to 4 days, depending on how much you're in the water. It will start peeling at the edges over time, and I usually just have my patients just start trimming it. If it starts peeling, I have you trim it where it's peeling, and that way you just trim the edges where it's peeling, and then that way it doesn't catch and rip or something off. It's easy for you to pull it off if it's bothering you. It is not made out of latex, so people who have latex allergies should not have a problem with this tape. So we are going to start by securing this end of it, and we're going to start by securing it right here towards the middle of her upper back. And then we're going to follow, this is the trapezius muscle that goes along here. And then it connects into the deltoid here. I don't put, sometimes we put some tension on the tape, but in this particular case I won't do that. And then I'm going to bring it down, as you can see, her deltoid. And then we're going to take it down her biceps. And usually it goes about midway down the biceps. And then the second piece is going to actually come across her rotator cuff area. This is where the 4 rotator muscles and tendons come in to connect into this joint. So this is going to help give her some stability in the joint itself. And it usually runs from the rhomboid area here, just right over to the front edge of where her armpit will start. Anyway, I try to avoid putting it in any areas where you have a groove, where, for example, you don't want it in the armpit, or an area where you would be rubbing it frequently. So we try to stay away from those kind of areas. In this particular part, we want to secure it starting in the middle, and this is the one that we're going to give a little bit more stretch to, and a little bit more stability to this particular piece of tape. So with this one, we started in the middle actually. And then once I get it secure there, I'm going to give it a pull and bring it down this direction, and then I'm going to give it a nice little pull, and then we're going to bring it across the front. Like that. Okay, and now you can turn around and show them Jill. So Jill can show you what it looks like in the end. She's got a tape that's going around, bringing across the trapezius, coming down, supporting that bicep and bicep groove. And then she's got one that's coming across this joint along here, and where these the rotator cuff tendons are starting to come into the shoulder itself. And so this is going to help give her shoulder a little bit more stability and movement and support when she's doing any kind of activity. And again, it'll stay for about 4 days. It'll start peeling at the edges, so you just trim it. And then when it really starts coming off, you can take it off. And then you reapply new tape each time until you get your healing process completed. Thanks.